So let's go over the kinetic chain of the shoulder. I'd like to show you what we do when somebody comes into the clinic and how we address it using motion-specific release techniques. So we'll start in a sitting position. Now, just for demonstration purposes, I actually may move from right to left shoulder so you can actually see the procedure a little bit easier here. So Mickey, why don't we start out with protraction and retraction. So I'm going to go behind the shoulder here and just take it straight forward and palm out there. Yeah, right up. How we doing?
That's good.
Feeling that a bit?
Yep.
So I'm going to go in behind here, and there's numerous structures I can address here around the scapula. Yeah, okay, good. And forward again. So I probably do most of these motions 3 to 5 times. And then I would move to the anterior, and I would actually get you to bend the elbow, and then you're going to bring the shoulder back like this, okay? Take it back. You should be feeling that one a bit.
That's pretty good.
Yeah. And again, of course, always work within patient tolerance. You okay?
Yep.
Good. And again. Good. Okay, now what we do is we, again, 3 to 5 passes, bring this in behind here like this. And I'm going to kind of get on the supraspinatus behind here, just in the groove on top of the scapula. Okay, take it back. And back. How are we doing there?
That's tight.
That does feel pretty tight. You okay?
Yep.
Good. So we're working around a number of the rotator cuff muscles here. Very effective for loosening this up. While we're in this position, I'm also going to go over one other area to increase scapular mobility. Bring your arm up here, bend your elbow, take it back, right over. How are we doing there?
That's good.
And back. And again. Feel that one quite a bit?
Yeah.
Especially at end range here.
Yep.
Now you're always dealing with myofascial structure, so it's not just the muscle, it's the fascia or connective tissue. So sometimes we have to hold end range for a little bit there. One more time. Good. Excellent. Now let's move to a sideline position. So let's move on to the procedures we use while laying on the side. Now, obviously, we're going to pretend that this is Mickey's right shoulder when I'm working on the left, just so you can see it a little bit easier. Okay, we're going to go behind here towards the lat underneath. How are we doing there?
That's good.
And I'm using a soft, open hand. So I'm not making a rigid fist by any means. Is that fairly comfortable?
Yeah, don't feel your knuckles at all.
Okay, good. And we're going to work down the lateral line here. And actually, what I'm going to do is just kind of work down a little bit farther. Bend this knee, take your leg off the table here. And we're just going to open up the whole side here. Okay. How are we doing there?
That's a good stretch.
Yeah, you feeling that all the way down the side?
Yep.
Good. And just hold. Good. This is a great way for opening up the kinetic chain of the shoulder. So it's not just the shoulder, but it's everything down the entire body. That's going to affect shoulder mobility function. You okay?
Yep.
Good. Okay, let's have you go face down, please. So I'm having Mickey go face down here because we want to address a particular connection between the gluteal muscle, thoracolumbar fascia, and the shoulder. So this is a way that you have the hip joint and the shoulder joint connecting. Now, to do this particular procedure, we'll actually get Mickey to take her leg here, bend it in, and actually bring it up as I'm doing the procedure there. You okay? Get the pattern there?
Yep.
Good. Hold this here.
Okay.
Same time, she's stabilizing yourself on the table. And then I'm actually going to move the fascia up in this direction here. Okay, bring the leg up there. Right up. Feeling that one?
That's good.
So as you see, I'm using my body weight too to actually go in there, but not compressing a lot, just using a bit of tension. You okay?
Yep.
Good, keep going. And we just kind of work our way right up as far as we can on the latissimus dorsi. Now where are you feeling that when I'm doing this?
Right from my hip up.
Yeah. Right across. Good.
Yeah.
Okay, now bring the leg back here. And what I'm going to do is actually get you to bend the leg off the table now and actually just set it on the ground. Good, perfect. Now you're going to take this arm and you're actually going to reach up like so.
Okay.
And I'm going to actually work this way towards the opposite hip. Okay, take that up. How's that going? And back. And again, right across. Perfect. And again. Good. And again. Perfect. One more time. And again, we repeat this 3 to 5 times until we feel the tissue becoming more malleable. And back. Now, we're going to address some of the anterior components of the shoulder. It's really important we get into pectoralis major, pectoralis minor. Quite often when people have shoulder problems, they don't realize a lot of it is postural related. In other words, we're texting, working on a computer, we have a tendency to shorten up the pecs, brings everything forward here, tightens everything up posterior. So it's really important we open up this area. So Mickey, can I get you to just take your right hand on top of your left breast, put it down, and you're okay with me working on the area here?
Yes.
Good. So I'm going to kind of work my way over, down. How we doing?
That's not as bad as it's been in the past.
Not quite as tight.
No.
Now, you want to work over more towards the sternum a little bit here. You okay? This is tight. Didn't want to say too much until we got over there a little bit.
Yeah.
Doing okay there?
Yeah.
So pec minor, pec major, but also the structures in between. Quite often people will say, well, I'm just working on this one structure. In reality, you're working through the connections. You're working through everything along the arm lines, all the way down. I'm sure you're starting to feel this all the way right down to your hand.
Yeah.
Good, perfect. And at the same time we're here, we kind of change the vector a little bit and come up and over. You okay? Taking it over. Perfect. Excellent. Now, while we're here working on this, again, 3 to 5 repetitions, trying to open it up, holding the end range, we also need to work on the glenohumeral joint. All musculoskeletal problems are never just the soft tissue or the joint. You always need to address both. In this case, we'll go through and get some mobility within the shoulder here. So I'm going to take this off the table, down. You okay there?
Yeah.
Okay. And we're just going to rotate it around. Yeah, a little bit of crepitus there, a little cavitation. Good. And down. And when I'm in this position here too, I can actually address the deltoid muscles quite easy, getting on the anterior medial deltoid, but mobilize the entire joint there. You okay?
Yeah, it's tender.
Okay. Yeah, a little bit there. It's just starting to let go a little bit. So you don't want to push too hard because I've got Mickey's arm fairly close to my body so that I can actually use some body weight from my hip here.
That's getting easier now, actually.
Getting easier?
Yeah.
Good. Okay. Now, just slide over a little bit, and there's one more component we need to address. So the other area we need to address are the facet joints of the spine in the thoracic region. Now, as a chiropractor, I would just go in and I would adjust and mobilize the area, or I would use specific techniques to actually open up the joints. Mickey, why don't you go into child's pose? So if I'm looking more in terms of mobilization, I would have the patient go into child's pose, and then I would take my hands and go fairly close to the spinous processes, out a little bit, in the little trough in between there, and then I would just push down on here slightly. Okay, how are we doing?
That's good.
Okay, come up just a little bit there. Now, stretch down. Stretch, breathe out. Excellent. Come up a little bit. Good. Breathe out. So you combine respiration with emotion, you'll find a much better release. It'll release a lot faster. One more time. And down. How's that feeling, Mickey?
That's good. That's getting a lot easier, too.
Yeah, good. So, just have a seat for a sec there. When we go through these procedures, you'll notice that we've gone through and we've actually gone anterior, posterior, medial, lateral. We've addressed the soft tissue, we've addressed the joints. And realistically, I could do this in a 15-minute appointment. And when you do that, you're going to cover all the areas of the kinetic chain. Using these motion-specific release procedures, you can get great results within a short period of time.